Everyone that's making a decision about Social Security and Medicare want to get the most out of both of those programs that they possibly can. But if you don't have the right education, you may make a mistake. So in this video, I'm going to show you exactly how to maximize Social Security and Medicare. Okay, let's begin by talking about maximizing Social Security benefits. Now, folks, there's four ways in which we can take Social Security benefits. It can be retirement, it can be a spousal, it can be survivor, and it can be disability. But for the purpose of this video, I'm just going to talk about retirement benefits. This means that you're actually drawing benefits off of your own work record, and which is 90% of all people. This is what they do. So that's why I'm going to forego the others. So let's talk about maximizing this. So what I want to do is just use the illustration of someone whose birthday is today. It is 2/27, and let's say they're born in 1958. Alrighty? And so the first thing that we have to do when we talk about maximizing Social Security is we have to know our full retirement age. Why is that? Well, because if we get to full retirement age, we know that there will be no impact on our Social Security check if we choose to work, and also we don't have to take less of a benefit. And so that happens at full retirement age. Now, anyone born between 1943 and 1954 has a full retirement age of 66 even. But after 1954, they begin to add 2 months to everyone's full retirement age. So if you're born in 1955, it is 66 and 2 months. 1956, 66 and 4 months. 1957, 66 and 6 months. 1958, in this example, we're going to add 8 months to our full retirement age. Anyone born in 1959, it would be added 10 months at 66 and 10 months. And then anyone born in 1960 thereafter at the present system has a full retirement age of 67. So back to my example, we're born 1958, it's going to be 66 and 8 months. So we know they're going to hit in 2024, they will be 66, but we have to add 8 months to that. And so how do we do that? Well, their birthday is in February, so we're going to add March, April, May, June, July, August, September, October. That's our 8th month. So their full retirement age will be October 2024. So if we get to October 2024, then what happens is there is no impact at all, there's no reduction in benefit, and if they choose to work, there's no earnings test. So we're talking about in this video maximizing those benefits. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. All right, so let's go back and let's talk about taking our Social Security early if someone decides, in this example, to take early. So we have 66 and 8 months, but if I decide to take at 65, 64, 63, 62, I can do so, but I'm going to lose 6% every single year in my benefit. And what's bad about that percentage loss, it is going to be permanent. So if you decide to take early, then you're going to take less, and again, it's going to be a permanent reduction. Now, another issue surrounds this. If I decide to take before my full retirement age and I decide to keep working, I can only make so much money. So if I want to maximize my benefit, even if I have to take early, I want to try to stay below the earnings test. Again, we're talking about earnings test. Now, when we discuss the earnings test, I want to make sure you're clear on the earnings that they are testing. It is working wages of yours only, not your spouse's. There's no rental income, investment income, distributions from 401ks, IRAs, any pension income, just working wages. The only thing that they're going to test. So we got this thing called earnings test. So here's the way it works. Anytime between the ages of 62 and 65, if you're still working, the earnings test this year, 2023, is $21,240. For every $2 I make above that, they actually reduce my Social Security by $1. So let's keep it simple. Let's say I make $4,000 above that. So I'm at $25,240. So I'm $4,000 above. They're going to reduce, they're going to take out $2,000 of my Social Security checks. That means they withhold $2,000 of the Social Security checks. And then once they've withheld that penalty amount, then they turn on my Social Security. Now do keep in mind that when they withhold, you eventually will get that money back. It is not going to be lump sum. They're just simply going to recalculate your benefit amount once you hit to full retirement age based upon the months that they had to withhold Social Security checks. So you will get it back, but again, it's going to be over a period of time. So the point is, if I want to maximize, we want to stay below the limit. Now, what happens though, the earnings test changes the year I turn full retirement age. Now keep in mind, I'm not there yet. It's just the year I turn. So in my example, if someone born today, this would be January of 24, right? Up to September of 24. So again, I haven't hit that full retirement age yet, but it's the year I'm doing that. Then what happens, my earnings test goes up tremendously, and it goes to $56,520, almost triples the amount, and the penalty is less. For every $3 above, they take $1 out of my check. All right? And so again, that's for that period of time here. In this example, 9 months. You can make up to $56,520. And so if someone is not making that much money, well, then they can go ahead and turn on their Social Security because there's not going to be any impact because they're below that amount. Again, if they're going to be above that amount, you may want to reconsider taking Social Security until you hit full retirement age. In this example there, why? Because once I hit full retirement age, then the earnings test is going to go away. I can make as much money as I want, and there's no impact at all to my Social Security check. All right, now, some of you will decide to wait beyond full retirement age. So here's the way that works. So this is 66 and 8 months. We can go to 67, we can go to 68, we can go to 69, and we can go to 70. And when I delay, I'm getting what's called delayed retirement credit. So now I'm growing my full retirement age by 8% every year, right? So I can grow that a full 32% if I wait to age 70. And so let me give you a quick example. Let's just say at full retirement age, I'm eligible for $2,000 a month. Down here, I grew at 32%, so now I'm eligible for $2,640 a month. And so I grew that a full $640, but I had to wait for 48 months to get it. So what we do is we do a break-even analysis. So let's say I take it full retirement age, I got $2,000 a month for 48 months. That means I had $96,000 in my pocket because I took my Social Security. If I wait down here, I get $640 more. So we take the $640 into these 640 months into 96,500. I've done the math in advance, and that's actually 150 months, which is 12.5 years. Okay, so my break even is what? So if I go to age 70, I've got to live another 12 and a half years to know that it was worth that additional $640. So I have to live to be 82 and a half years old or longer, and I'll know that it was worth that to go ahead and delay taking my Social Security. And again, none of us know when we're going to pass away. God knows that, but we don't know that. And so it really boils down to you deciding what are you comfortable with as far as your longevity. Now, again, if your mom and dad lived to be 90, 95, or whatever, long periods of time, then you may have longevity in your bloodline. If everyone in your family dies before 80, that may not be the best decision. But again, we want to maximize our Social Security, so these are ways that we can do it. We want to be sure to stay below the earnings thresholds. If we take before full retirement age, if we take at full retirement age, we don't have to worry about that. Sometimes people want to delay it so they can grow those accounts because why? That's an additional 8% you're growing your money. Very difficult to get an investment today that's going to give you that kind of guaranteed return. Now let's talk about maximizing our Medicare. Now, as you look at your Medicare options, you'll realize very quickly that we really can boil down our Medicare options to three and only three options for using our Medicare coverage once we decide to go. Now remember, not everyone has to start Medicare at 65. If you or your spouse are still working, covered by a group plan that has 20 employees in the company or more, you don't have to start Medicare at 65. Everyone else, you have to. Retiree plans, COBRA plans, ACA plans. Those of you that have 19 or less employees at the company, got to go on Medicare. If you're on TRICARE, got to go on Medicare. All right, so the only people who don't take Medicare at 65 or that are required to are those that are still working or their spouse is 20 or more employees, and you're covered by a group plan that is better than your Medicare option. All right, so once we go on Medicare, we have 3 options in using our Medicare, and I'm going to show you how you can maximize those benefits. So one option we have is to stay in what we call A and B, and you have A and B only. So all you have is that Medicare card. Another option you have is to do what's called a C plan. These are also called Advantage plans, right? So this is the lowest amount of coverage. This would be the mid-level. And then the best, as far as insurance goes, is to have A and B, and then you get a supplemental plan. Supplemental plan, these are also called Medigap policies, all right? So those are one and the same, SUPs or Medigaps. All right, so let's talk about why A and B would be the least amount of coverage that you have. The reason for that is because A is called inpatient hospitalization care and skilled nursing, and B is called outpatient. Okay, so N is, again, hospital, skilled nursing. The B is going to be everything that would be outpatient related, cataract surgery, gallbladder removal. All the doctors that you go to see are covered by B, or they come to see you in the hospital. B pays the bills. This would be where durable medical equipment is going to be covered. Home health care is going to be covered. So again, this is inpatient, outpatient. So what happens in both of these systems is that the only thing Medicare pays for 100% is the preventive services. They don't cover anything else 100%. There's always a balance that you're going to be responsible for. So Medicare pays, but there's going to be a balance of the bill, and those can be very substantial. We call those gaps in your coverage. So on the inpatient side, we have 3 gaps. Okay, we have deductibles and we have copays that you're responsible for. On the outpatient side, we also have 3 gaps. Okay, you have a deductible and you have a coinsurance, 20% of coinsurance on the B side, and you have excess charges. That's when a doctor adds to the bill. So my point is, the reason this is the least amount of coverage is because of all these gaps that you're responsible for, and they're very, very substantial. Also, in this scenario, we're not even talking about a drug. You don't have a drug plan either. In other words, you just chose not to get that. And I'm just saying to you, that is not a good decision at all. The only reason that'd be a good decision if you qualify for state Medicaid, then that may be a decent decision. But otherwise, A and B is going to be the least amount, primarily because of all the financial liability that you have in that system. And the biggest one over here on the B side is the 20% coinsurance that never stops. In other words, there's no stop-loss limit. It keeps going and going and going, never stops. So that's the least amount of insurance coverage. The next above that, I would call this mid-level, is called an Advantage plan. And so the way it works with Advantage plans is these are private health insurance companies, okay, that basically are replacing original Medicare A and B for you. And what they have to do is basically match those benefits, but they're replacing it. So now here, I can go anywhere that takes Medicare. Over here, now I have a private insurance plan that is going to be either an HMO or a PPO. And again, when we talk about maximizing your Medicare benefits, now all of a sudden, I limited that because now I'm going to have a network of providers. Not everyone's going to take Advantage plans. There are plenty that do, but there are plenty that don't. And so what you have to realize is that you will have network issues here because we have a private health insurance company that puts together a plan for you and they replace original Medicare. Okay, so what else happens here? Well, not only do we have a network, but now what we're going to do is that we're going to have copays. For a lot of the services that we need, the majority of them. And then we could have some coinsurance. We could have some 20% type items with the Advantage plan. Now, a lot of people are attracted to Advantage plans because most of them have a 0 premium to the Advantage company. Now, keep in mind, you still have to pay your Medicare Part B. Remember, A is free for most people, but B has a premium. So when I enroll in an Advantage plan, I still have to pay Medicare their part. And then out of my pocket from then on out will be copays and coinsurance. Now, the good news is that copay coinsurance portion will every year have a max out of pocket. And again, depends on what plan you're on. It's going to range anywhere from about $3,000 to maybe $7,000 and sometimes upwards of $10,000. But I pay as I go for all my services until I hit the max out of pocket. And then every January these reset and then we start paying as we go again. All right, and so the point of this is a mid-level coverage. Now, what happens, a lot of people, they look at all the perks that the Advantage company actually will throw in with the Advantage plan. Perks such as a little extra dental benefit, maybe a little extra eye benefit, eyewear, some hearing aids, gym membership. So these Advantage plans are loaded up with perks, but you also have to ask the question, well, how's my insurance going to work? All right? And so that's why I'm saying this is more of a mid-level. Again, a good option for some people, many people, but again, it's still that mid-level. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. So let's talk about what I would say would be your highest level of coverage as far as insurance goes, how to maximize, and that is to enroll in A and B. But because of all these gaps, what you do is you get a supplemental plan. And there's top 3 plans right now, the F and the G and the N. Now the way it works is we have these gaps. So the F plan fills in 6 of 6 gaps, meaning it really is a full coverage plan. Medicare pays, supplemental plan will fill in the difference. Obviously, full coverage is going to be the most expensive one, but also in order to get an F plan today, you got to be born before January 1st, 1955, starting Medicare before January 1, 2020, okay, to get an app plan. Some of you, you're born after that, so you can't do that, all right? But as long as we're born before then, we can get an app plan, full coverage. The G plan is the most popular today, and what it does, it covers all 5 of the 6 gaps. So it covers everything on the A side, but on the B side, it covers 2 of the 3 gaps. The gap it doesn't cover is called the B deductible. It's an annual amount. This year is $226. So the only difference between that F and G is you would be out of pocket, that B deductible. All right, so that means the first $226, and this is for the whole year, would be paid by you. Then after that, we have 100% coverage. All right, so that's why I'm saying this is how to maximize your benefit. Now, the N plan, not as popular as the G in most states, but some states this works, but it's only going to cover 4 of the 6 gaps. Right, so what happens here? Well, it covers everything on the A side, but on the B side, it does not cover the B deductible, and it does not cover excess charges. So when a doctor adds to the bill, you would have to pay for that out of your pocket if you're on an N plan. So the gap it does cover over here is that 20% co-insurance. But it doesn't cover excess, doesn't cover the B deductible, all right? And then plus, not only that, we also have $20 copay every time we see a doctor, $50 copay whenever we go to an emergency room. So what we're doing is we're taking on a little bit more liability. The premium is going to go down as well. Now, the difference between the G and N is usually about $30 a month. So a person has to decide, is it worth the risk of taking on excess charges in these copays for that extra $30 a month? And some decide it is and some not. But the whole point is we're talking about maximizing our Medicare. So this would be your highest level of coverage. And the reason for that is this. Number one, we have no networks. No networks. You can go anywhere that takes Medicare. You don't have to worry about an HMO or PPO. Just as long as the provider takes Medicare, go wherever you want, they'll take your supplemental plan. Secondly, you never have to worry about pre-authorizations in this system. Okay, which means what? Over in this system, you have about 70% of your services have to be pre-approved, pre-authorized by the insurance company. And sometimes they say, no, we're not going to pay for that knee replacement. We don't think you need it. We're not going to cover that hip replacement. We don't think you need an MRI or whatever. And so they have the right to do that here because it's a pre-approval, pre-authorized system. Over here, they can't do that. If Medicare says they'll cover it and the doctor says you need it, the insurance company has no say-so whatsoever. And that's one of the frustrating things with Advantage plans. Is because of those pre-authorizations. They can delay the coverage, they can deny the coverage, and really even disrupt the coverage at times. It can be annoying. And then lastly, what happens is this. When I first go on Medicare, I can have a supplemental plan, Medigap policy, with no underwriting required whatsoever. When I first go on Medicare, I have 6 months before I start Medicare, 6 months after I start Medicare, B, that you can have anything you want. There's no health questions asked. It's a guaranteed issue. Company has to write the policy. But after that, in 46 of 50 states, okay, so the 4 states that are different would be New York and Connecticut and Vermont and Massachusetts. I think I'm right on those. But 46 of the 50 states, you have this 12-month period, 6 months before you go on Medicare B, 6 months after, no underwriting. But after that, if you ever want to get a supplemental plan, now you're going to have to medically qualify to get the supplemental plan. And that's the beauty of it, because once you have a supplemental plan, it is yours for life. But if I'm on an Advantage plan, I ever want to switch to that supplemental plan, and I've been on that Advantage plan for 2, 3, 4, 5 years, and now I want to switch over here, now I have to go through underwriting to make the switch, which means if you have some health issues, that company has every right to deny you. And all of a sudden now you can only be in this system. And again, if you want to maximize your Medicare, then in my opinion, you'd have A and B, and then you would get that supplemental plan to fill in those gaps. There'll be no financial surprises. We have no networks to deal with, no pre-authorizations. You have a lifetime policy.